Overview. In the present healthcare environment of short hospital stays, patients attended in the medical office usually have acute problems requiring extensive and comprehensive education from their healthcare provider. This role will be one of the most rewarding and challenging roles as a medical administrative assistant. Patient education is done under the direction and supervision of the physician. The types and amount of patient education may vary greatly from office to office. This chapter will provide the basic skills required for providing patient education. The patient education process. Patient education is actually more than just telling patients which medications they should take or which lifestyle they need to modify and expecting these patients to follow these guidelines blindly. For effective patient education, the CMAA needs to help patients accept their conditions, involve those patients in getting knowledge, and provide positive reinforcement. Eventually, that knowledge and education should lead to a modification in attitudes or behaviors. The patient education process involves 5 main steps: evaluation, planning, implementation, assessment, documentation. These primary steps collectively generate the teaching plan. The plan can be written formally as the process is happening or can be documented after the event. The CMAA should follow all these 5 steps to provide effective patient education. Patient's Bill of Rights. Patient's Bill of Rights was designed by the United States Advisory Commission on Consumer Protection and Quality in the Healthcare Industry in 1998. The bill was developed to achieve 3 major goals. 1. To help people feel more confident and comfortable in the United States healthcare system. 2. To focus on the significance of a strong relationship between healthcare providers and their patients. 3. To focus on the major role patients can play in staying healthy by outlining out the main responsibilities of all patients and their healthcare providers. This Bill of Rights is also applied to the insurance plans provided to federal employees. Multiple different health insurance plans and facilities have also adopted the Bill of Rights. Even Medicaid and Medicare stand by many of them. The 8 major areas of the Patient's Bill of Rights. 1. Information for patients. Patients have the right to easily understood and correct information about their health plan, healthcare facilities, and healthcare providers. If they speak another language, have a mental or physical disability, or just don't get something, appropriate help should be provided so they can make informed healthcare decisions. 2. Choice of providers and plans. Patients have the right to select healthcare providers who can provide high-quality healthcare when they need it. 3. Access to emergency services. If patients have severe pain, sudden illness, or an injury that makes them think that their health is in danger, they have the right to be stabilized and screened through emergency services. Patients should be able to access these services wherever and whenever they need them, without waiting for authorization and without any financial penalty. 4. Taking part in treatment decisions. Patients have the right to understand and be aware of their treatment options and take part in making decisions about their clinical care. Parents, family members, guardians, or others that they choose can speak for them if they cannot make their own healthcare decisions. 5. Respect and non-discrimination. Patients have a right to receive respectful care from their physicians, health plan representatives, and other healthcare professionals that do not discriminate against them. 6. Confidentiality, privacy, of health information. Patients have the right to communicate privately with healthcare professionals and to have their healthcare information secured. They also have the right to review and copy their own medical record. Patients have the full right to ask that their doctors change their record if it is not accurate, complete, or relevant. 7. Complaints and appeals. Patients have the right to a fast, accurate, and objective review of any complaint they have against their health plan, hospitals, physicians, or other healthcare professionals. This may include complaints about operating hours, waiting times, and the actions of healthcare providers. 8. Consumer responsibilities. In a healthcare system that protects their patients' or consumers' rights, patients should also be expected to take some responsibilities to get healthy and/or stay healthy, e.g. exercising and not using tobacco. Patients are expected to treat healthcare professionals and other patients with respect and dignity, try to pay their bills timely, and follow the rules and regulations to receive maximum benefits of their health plan coverage. Consent. It is necessary that patients must agree or provide consent to being touched, evaluated, examined, or treated by the healthcare provider or agents of the provider involved in the contractual agreement. No treatment or intervention can be made without consent provided orally, nonverbally by behavior, or in writing. Patients have the right to nominate a healthcare power of attorney or healthcare surrogate who may take healthcare decisions when the patient becomes to make them. A healthcare surrogate can be the patient's spouse, a pastor, a friend, or an attorney. A healthcare durable power of attorney provides the patient's representative the permission to take healthcare decisions as the healthcare surrogate. A patient's healthcare provider should be aware of the power of attorney agreement, and a copy of all the patient's legal documentation should be kept in the official record. Two major types of consent should be obtained when delivering care to a patient: implied and informed. 1. Implied consent. In the typical visit to the provider's office, the actions of a patient may show an informal agreement for care to be provided. A patient raises a sleeve to get an injection implies his or her consent or agreement to the treatment. Implied consent is also useful in an emergency. If a patient is in a fatal and life-threatening condition and is unable to provide verbal consent for treatment, it is implied that the patient should receive the treatment if possible. When there is no urgency or any emergency condition, implied consent should be applied only if the intervention poses no prominent risk to the patient. A medical administrative assistant must not force a patient to have an intervention or procedure performed. If a patient refuses a procedure, such as a BP check or drawing blood, the medical administrative assistant should note the decline in the patient's chart. The office policy may also need him/her to report the decline of care to the healthcare provider. 2. Informed consent. Whenever a patient is scheduled for an invasive procedure, such as surgery, the healthcare provider must obtain informed consent, which is a written consent form that is signed by the patient. The healthcare provider should make that the patient understands the procedure, the reason for performing the procedure, the person who will perform the procedure, expected outcomes of the procedure, major risks of performing the procedure and not performing it, available alternative options and how the benefits and risks compared to those of the recommended procedure. The medical administrative assistant may ask the patient if the patient has any further questions in his/her mind for the healthcare provider. If the medical administrative assistant suspects that the patient does not understand the nature and outcomes of the procedure, he/she should inform the healthcare provider immediately. A consent form should have the following information: the procedure's name, the physician's name who will perform the procedure, name of the anesthesia administering person, if applicable, any major risks from the procedure, anticipated outcomes or benefit of the procedure, alternative options to the procedure and their major risks, possible effect on the patient's condition if the procedure is delayed or not performed, any exclusion options that the patient wants, statement representing that all of the patient's concerns or questions regarding the procedure have been addressed, the date along with the patient's and witnesses' signatures. The informed consent form provided for the patient's signature should be in the language that the patient understands. Most healthcare providers who treat multicultural patients have a variety of consent forms available in multiple different languages. The medical administrative assistant should never request a patient to sign the consent form if the patient does not understand or know about the procedure, has unanswered questions and queries related to the procedure, is not able to read or understand the consent form. Government and private insurance. Healthcare in the U.S. is organized and handled in a complex bureaucracy. While in many parts of the world healthcare facilities are generally owned by governments or by the private sector, in the United States a major share of clinics and hospitals are owned by private nonprofit organizations. Yet, the U.S. is the region that has the maximum healthcare expenditures in the whole world. While these healthcare expenditures are covered in a major share by public payers, as by federal governments, or local and state institutions, they may also be covered by individual payments and by private insurance. Additionally, unlike most developed countries, the United States health system does not offer healthcare to its whole population. As there is no standard and single nationwide healthcare system of health insurance, the U.S. primarily depends on employers who voluntarily offer insurance coverage to their employees and their dependents. At the same time, the government has insurance programs to cover healthcare expenditures for the fragile portions of the society as the poor, elderly, and disabled population. These healthcare insurance programs greatly differ from one another, and all have a certain type of people that are subject to avail these benefits. Government insurance. The 6 main government healthcare insurance programs: Medicaid, Medicare, the SHIP, State Children's Health Insurance Program, the Veterans Health Administration, VHA, program, the Department of Defense TRICARE and TRICARE for Life programs, DoD TRICARE, and the IHS program, Indian Health Service Program, offer medical services to about 1/3 of U.S. citizens. The federal government is responsible to make sure that these programs are used wisely to minimize the burden of injury, illness, and disability and to improve the health and well-being of their population. It is important to note that the federal government appoints strong leadership in managing serious shortcomings in the quality and safety of healthcare in the U.S. population. The 6 main government healthcare insurance programs serve older people, people with disabilities, low-income mothers and their children, active duty military personnel and their dependents, veterans, and Native Americans. The major 3 programs, Medicaid, Medicare, and the State Children's Health Insurance Program, SHIP, were designed for groups for whom the healthcare industry has historically failed to perform because of their high healthcare requirements and low socioeconomic status. The remaining 3 healthcare insurance programs, VHA, DoD TRICARE, and IHS, serve certain communities with whom the federal government has a specific relationship, such as veterans, military personnel and their dependents, and Native Americans. Commercial insurance coverage. In the United States, there are a variety of different private healthcare insurance organizations. There are several kinds of health insurance plans to meet certain needs. Health Maintenance Organizations, HMOs. An HMO plan generally covers care only from healthcare providers who work for or contract with the health maintenance organization. It usually doesn't cover out-of-network care. An exception is an emergency and life-threatening condition. Some HMOs require that healthcare providers must live or work in their service area to get the eligibility for this coverage. HMOs mainly focus on integrated healthcare, with stress on preventative care and wellness. Exclusive Provider Organizations, EPOs. An EPO plan is a part of the managed care plan that covers services provided by the physicians, hospitals, specialists in the plan's network. The only exception is an emergency condition. Point of Service, POS, plans. These plans have lower out-of-pocket fees if someone uses physicians, hospitals, and other healthcare professionals that belong to the plan's network. These plans also need a referral from the primary care provider before someone can see a specialist. Preferred Provider Organizations, PPOs. PPO plans contracts with healthcare providers, such as doctors and hospitals, to develop a network of participating providers. The patient pays less if he/she uses providers that belong to the plan's network. The patient can use physicians, hospitals, and other healthcare providers outside of the network, but he/she has to pay an additional cost.